we're back with diabetes medication. Again, we're here with our favorite endocrinologist, Dana Stallings. Dana, we're excited to learn about this drug class. Take it away.
And I am excited to tell you about it. The GLP1 receptor agonist class is one of my very favorite classes of medication to use and one of my most commonly prescribed. Byetta was the first medication that we had on the market in the GLP1 receptor agonist class. And that was a twice daily injection. From there, we went to Bydureon, the one above it, that you can see if you're looking at the generic names, both of them are exazenatide, but Byetta went from being twice daily to Bydureon only being once weekly. And so it was much easier for patients to take it once weekly versus having to inject twice daily. Now we have Trulicity, which is also once weekly. And then moving back down the slide, we have Ozempic, which is once weekly and is one of the newer medications on the market in this class. And beneath it, we have Victoza. That is once daily. And below that is lixisenatide. That is not available by itself on the US market. And so we use lixisenatide as a combination medication, specifically if any of you are on Soliqua. That is a medication that has Lantus insulin inside of it, plus lixisenatide. So it is available as a combo agent, but not by itself. The main thing to pick out of this drug class is that it is injectable. So this is an injection, but it is not insulin. And so oftentimes when I recommend this class of medication to my patients and tell them that it's an injection, they tell me, nope, they don't want to be on insulin. And that's a good thing because a GLP-1 receptor agonist is not insulin. Also, though, you can see on the left side of your screen, we have oral semaglutide, Rybelsus. Rybelsus is the brand name. That is relatively new to the US market, and it is the GLP-1 receptor agonist in a pill form instead of it being in an injection form. It's the only one that's available right now. You do have to take that particular pill at least 30 to 60 minutes every morning before you eat or drink anything. And so for some patients that can be difficult, in particular if you have any thyroid medication that you generally take in the morning as well, because you cannot take Rybelsus with your thyroid medicine. And if you take Rybelsus too close to your breakfast, then you may experience some of the side effects that we'll talk about on the next slide. Or it simply may not work very well because it's going to be blocked by the food that's in your stomach. So I use Rybelsus. I have patients on Rybelsus, but I tend to use the injection more commonly. Trulicity, Ozempic, and Victoza are the main ones that patients see on the market right now, in addition to Bydureon. Bydureon is also available in a different pen format called Bydureon B-Size. And so if you're on Bydureon or B-Size, then you're still on exazenatide. It's still the same medication. It's just that they changed the way that the pen is delivering your medication to you. These medications work to help release insulin when your blood sugar levels rise at mealtime, slows the absorption of mealtime glucose, and lowers the amount of glucose produced by the liver. So more concisely, what I tell my patients is that it helps all the way around because it's going to help in the liver to reduce the amount of glucose that is being released, because when you're eating and you're eating carbohydrates, you don't need all of that extra glucose being released from your liver. And so the GLP-1 medications are going to help to tune the liver down without shutting it off entirely. It can also actually ask for more insulin from your pancreas when your blood sugar levels spike, typically around mealtime. When you eat something and your sugar levels rise, your pancreas is going to send out more insulin to grab that spike in sugar and pull it back down to a normal baseline blood sugar. or more specifically what's important, or excuse me, not what is important, but what is normal for you, a normal blood sugar for you. But we're back to that GLP-1 hormone that's in your stomach. That GLP-1 hormone is responsible for converting carbs into glucose. And then that glucose is absorbed from your stomach into your bloodstream, which is what makes your blood sugar levels rise. At that point, your pancreas is being stimulated to release insulin to bring your blood sugar levels back down to cover that spike in sugar that just happened as a result of eating. That spike in sugar happens in everyone. So it's not just because you're diabetic that your sugar is spiking. It happens in non-diabetics. But in a non-diabetic, the pancreas is able to release enough hormones, GLP-1, insulin, etc., to cover that spike and return your sugars to normal. As a diabetic, you need a little extra help with that. And that's what the GLP-1 receptor agonist class is helping you to do. So it's going to help to release more insulin to bring your blood sugar level back down after you eat. And in doing so, it's helping to restore that GLP-1 hormone in your stomach so that instead of your body absorbing that food and those carbohydrates that you're eating really, really quickly, which is going to lead to a very sharp spike in sugar, usually followed by a very sharp drop in sugar, it's going to slow the absorption of those carbohydrates from rapid to a more normal level so that your blood sugar level won't spike and drop, but you'll have more of a rolling hill effect of glucose control, which is going to help your insulin and your pancreas to better keep up with your glucose spikes so that you don't have all of the high sugars or the severe drops in your blood sugars every time you eat. The most common side effects in this medication is going to be nausea. That GLP-1 level in your stomach tends to be low. And so when we put that GLP-1 hormone back into your stomach, your body has to get used to it being back where it's supposed to be. And that can manifest for you as a little bit of nausea as your body is regulating its hormones. This should not last forever. If you have nausea beyond about 72 or 96 hours, 3 or 4 days, then you should call your healthcare provider. In particular, if you have severe nausea with vomiting and abdominal pain, this medication is not for you. But in the majority of patients, it's just a little fleeting amount of nausea when you first start the medication, and also if your healthcare provider increases your dosage. It's not abnormal to have a little bit of nausea with a higher dosage, but then after a day or two, it should go away. Vomiting and diarrhea are common side effects, but they're also severe side effects. And so just because they're common doesn't mean that it's something that you should live with. Consult with your healthcare provider because you do have a slightly increased risk of pancreatitis in this class of medication, a little bit more so than the DPP-4 class of medicines that we spoke about in an earlier module. These medications do tend to have a higher risk of pancreatitis, and you're going to seek medical attention if you have severe nausea, vomiting, abdominal pain, or diarrhea. Do not use these medications if you have endocrine neoplasia syndrome. That is something that's generally going to be treated by an endocrinologist, or thyroid complications. Thyroid complications does not necessarily mean hyperthyroidism or hypothyroidism. It's a specific complication and, kind of more so back in with thyroid cancers, but only specific types of thyroid cancers that you should avoid use of these medications. But if you have any questions whatsoever, talk to your healthcare provider.
Great clarification. Thank you so much, Dana.